It's the Happy Families podcast. It's the podcast for the time-poor parent who just wants answers now.
It's normal and reasonable in this context of the last 2 years of COVID, the global pandemic. It's normal to have questions about vaccines, and it is important that parents are well informed so that they can make an informed decision.
And now here's the stars of our show, my mum and dad.
There may be no topic more controversial, more provocative, the kind of topic that fires parents up at the moment than the issue around kids and whether or not to get them vaccinated against COVID-19. Hello, this is Dr. Justin Coulson. Very excited today to have a conversation that I think might be a little bit hard, but very, very important. We're talking today with Professor Alison McMillan. Professor McMillan is the Chief Nursing and Midwifery Officer for the Commonwealth Department of Health, and she joins me on the Happy Families podcast right now to talk about some tough things. Thanks for joining me, Professor.
Thank you, Justin. It's lovely to be with you.
I'm going to ask these questions based on concerns that a lot of parents are sharing. So many of the questions probably don't reflect my personal opinion, but I really want to answer or get answers from somebody like you to these questions, because this is the stuff that bubbles up on Facebook or on Twitter or in the conversations that we have in the school car park or down at the beach or the park or wherever it might be. So first off, new research shows that less than 50% of kids aged 5 to 11 have received even one dose of the COVID-19 vaccine, and only around about half of 1% have been double dosed. Why do you think that parents are holding back?
Justin, I think firstly, we just need to remind ourselves that the vaccination is one of the most successful and cost-effective advances in public health across the world. And we know that vaccines prevent the death of somewhere between 2 and 3 million people a year. So the context of vaccines is really important. In Australia, we have one of the most comprehensive immunisation programs in the world. About 94% of children under the age of 5 are fully vaccinated in Australia or immunised against 15 diseases. So parents are, I think, very familiar with the vaccine programs, and the uptake, as I say, in Australia is some of the highest in the world. But it's normal and reasonable in this context of the last 2 years of COVID, the global pandemic. It's normal to have questions about vaccines, and it is important that parents are well informed so that they can make an informed decision and they can give information to their children in a way that they can understand as well. And I am often very concerned, and you mentioned social media just moments ago, about some of the misinformation that's out there. So I do recommend that when parents are looking for information, they go to reliable sources, and I'll promote, obviously, Health.gov.au, and very importantly, talking to a health professional, particularly a general practitioner, about concerns, because you need to explore those.
Yeah, so it's really interesting, Professor McMillan, when you say that. I know you were about to go on, but I just want to jump in because the idea of being well informed, if you ask anybody who's getting their news off Facebook or off whatever social media platform that they're getting, they will insist that they're well informed. I had a conversation on Sunday with a person who told me clearly that they're science-minded and they do all of their own research. Now, as somebody who is science-minded and does all of my own research, I found that some of the claims that this person made were less than strong. I get the sense that there's a fundamental mistrust now of mainstream media and even of government departments and even of the medical establishment. I don't think that the huge fines that Big Pharma have paid over the last few years in any number of contexts across the world have done any favours for the way people are viewing them at the moment. So how do people know that they're being well informed when they've got these mistrust issues?
Well, I appreciate that people may, it has been a very challenging 2 years, and information does come to us from a whole range of different places. Obviously, I'm going to say to you, Justin, that I do have confidence in the expertise that we have in this country. The Therapeutic Goods Administration, the TGA, is considered one of the best regulators across the world and is connected with all of the great regulators. ATAGI is led by some of the smartest people I know, but also, I would say, Justin, the wisest. So they give frank and fearless advice to government in a way that's very balanced and sensible, and does follow the evidence principles that we know in science, particularly those described by the NHMRC, or the National Medical Health Research Council. So the evidence that TARGI users and TGA users, is that agreed to by the scientific community in Australia? And I would say that I have confidence in the professionalism of those people.
Most people that I talk to are saying this thing's only new and we don't really know what's going to happen in 2 years, 5 years, 10 years. One of the most common ones that I hear all the time is fear of infertility. Can you address that one?
I can, and certainly that's been raised with me on many occasions in the adult, the adolescent, and across the general population. So what I can say is definitely there is no scientific evidence to support that there is any impact on fertility from these vaccines. Certainly, if we continue, as I've said before, all of the vaccine companies are required to continue to provide the TGA with data. The TGA work with all of the other regulators across the world. So it's not just that we're saying that it's not impacting fertility in Australia, but it's not impacting fertility across the world.
I'm speaking with Professor Alison McMillan. Professor McMillan is the Chief Nursing and Midwifery Officer for the Commonwealth Department of Health. Right after the break, we're going to ask a couple of other questions like what's the big deal when it comes to kids not really getting all that sick from COVID anyway? Why do we need to get them vaccinated? And a couple of other tricky conversation points around how Australian parents are responding to the request to vaccinate 5 to 11-year-old kids.
It's the Happy Families Podcast.
Are screens creating tension at home? Tweens, Teens and Screens is a webinar to guide families to healthy, safe super screen solutions. Buy it today at happyfamilies.com.au/shop.
It's the Happy Families Podcast, the podcast for the time-poor parent who just wants answers now. Today, very grateful to be able to spend some time with Professor Alison McMillan, the Chief Nursing and Midwifery Officer for the Commonwealth Department of Health. Alison, I have another question for you. This is one that I'm hearing consistently. It may be the most regularly repeated refrain that I hear in relation to kids and the vaccine. As a general rule, children are barely affected by the virus. I'm not saying all kids. Obviously, it's not all kids. But most children, certainly in almost every conversation that I've had with anyone whose children have contracted COVID, the parents basically say, yeah, they had a headache or a sore throat for a day or two, and then they were in isolation for 7 days and were climbing the walls. There was nothing the matter with them after a couple of days. How do we reconcile the fact that COVID doesn't seem to be affecting too many of our kids in any significant way with this push to get them vaccinated against something that doesn't seem to have a big impact anyway?
So Justin, I'll break it into a number of parts because I think it's important to look at this from a number of different directions. I think, yes, as you're right, we are hearing and reporting that particularly with Omicron, people are seeing milder symptoms, headache, tiredness, generally feeling a little bit unwell, but not hugely unwell. Might put them in bed for a day or so, or just be a bit grumpy. As we all know, kids often tend to be very grumpy when they're initially unwell. But that's not true for all children, and particularly those who are immunocompromised, children who may have chronic diseases. Obviously, they are more susceptible to any virus, and obviously COVID is one of those.
You're asking parents to inject their kids with a biological agent that's been found to have at least something of an injurious effect on part of the population. For most, it's just a very, very short-term injurious effect. But for some, it's for an infinitesimally small part of the population, there are some people who are affected really, really badly by this. And parents hear about it and they worry that their child might be the outlier, the 1 in a million that's harmed with myocarditis, for example, or they worry that their child has some sort of compromised status and that this is going to be worse for them. The Australian government's own health data shows that 0.4% of those who are given this biological agent, this vaccination, end up having an adverse event of some kind. 2.2 per thousand. That's 2.2 per thousand doses because everyone gets double dosed minimally. That's 4 people per thousand vaccinations, or 0.4% are having an adverse event. When parents hear about this, do you think that can help to explain the hesitancy, and when weighed up against the risk of COVID for them, Do you think that it helps to explain why we've got so many parents saying, not for my kids? Happy to do it myself even, but not for my kids.
You gave me an awful lot of data very quickly there. So let me go back to the beginning and acknowledge and admit that it is reasonable, and one would not be surprised if parents didn't have some hesitancy. So it is very reasonable to be hesitant. And again, as you said, that the parent might have a concern about their child being the outlier that may suffer a side effect. I think it's important for me to reiterate, though, a side effect could be as minor as a sore arm, some chills, a headache, or those sort of things. They're side effects, and that the significant side effects associated with vaccines are incredibly rare. On the other side of this, of course, is that would you want your child to be the unlikely but rare outlier that unfortunately contracts COVID and gets extremely sick? So both of them have rare, significant consequences, whether it's vaccination or whether it's not vaccinating. And ultimately, the parents need to weigh up. And I suppose, Justin, I've tried to explain that there are benefits for the child, there are benefits for the child within the family, and benefits across this broader society that need to be thought about in the context of this pandemic.
I was going to ask you a question about your principal argument for encouraging parents to vaccinate their kids, but I want to test my listening skills and see if I can answer the question as you would probably answer it and get you to fill in any blanks that I might miss. I'm going to guess that if I was to say, what's the main reason, what's the principal argument for encouraging parents to vaccinate their kids, you're going to say, number one, because the science says that the vaccine actually works. It protects kids. The weight of evidence suggests that the risk of catching COVID is going to end up being worse than any risks that a vaccine might present. The vaccine is a healthier, safer, wiser option, and that it protects kids, it protects families, it protects the community, and it reduces transmission, and ultimately it reduces the ill effects of the disease. Is there anything that I've missed there that you think would be convincing or helpful for parents who are sitting on the fence and wondering whether they should go down this path?
I think you've covered it pretty well there. Thank you. Yes, you have done that very well. I think yes, and that is the reason that we know we've been vaccinating our children for a very long time, because we know that the benefits you've described are the benefits that ultimately are for a range of vaccines. Not solely for COVID-19.
Well, I think this has been a really important conversation. I'm so grateful for your time. There will be some people who will want to listen to this conversation again to soak up the things that you've said and really, really work through them. And some people might want more information. If they do want more info, where would you send them?
Well, there are more than 10,000 places across Australia where you can access the vaccine at the moment. You can look them up on the websites. I do encourage parents to talk to health professionals, to talk to your general practitioner, to talk to those with expertise in the vaccine clinics, the pharmacists, the nurses, the nurse practitioners, those that are administering the vaccine across the country. They have all had specialist training. They all have been required to complete specialist training before administering these vaccines, and they are there to help you explore and voice your concerns and provide you with very reliable information that will help you make a decision on vaccinating your child. So the other place, obviously, I'm going to plug is our website. Our website is Health.gov.au, and our information there is provided in a range of different ways, including videos, and also provided in multiple languages, because we acknowledge that we need to reach a very broad audience. And so it's provided in a number of ways to make sure that people can understand the information as it is today.
Well, Professor Alison McMillan, the Chief Nursing and Midwifery Officer for the Commonwealth Department of Health, thank you so much for your time and sharing your knowledge with us on the Happy Families podcast.
It's been my pleasure. Thank you.
Well, I hope that helps to shed some light on the topic for you and moves you closer to a firm decision one way or the other in terms of what's going to be best for your kids. There's a whole lot more in the show notes if you'd like to get links or more information about our conversation today. And as always, we appreciate how Justin Rulon and Craig Bruce help us to sound great. They're our producer and executive producer, respectively. The podcast exists to help you make your family happier. If you've got any feedback for us, we love it via podcasts@happyfamilies.com.au. And if you don't mind, can you jump onto Apple Podcasts and leave a rating and review? Let us know how much you're enjoying it. We love those 5-star ratings and reviews. They help other people to find out about the podcast and bring it up in their feed. For more information about making your family happier, you can go to happyfamilies.com.au.